Hi, and welcome to our root cause analysis case study entitled Unavailability of an MRI System for Neurovascular Scans. This is going to be based on the sourced article below, Managing MRI Risks. Let's get started. Let's start with some case background. This is a regional hospital that has 3 MRI suites. All suites were designed and built for diagnostic purposes. A decision was made to use these suites for breast imaging and biopsies without any updates or adaptations to the suite. Hospital infection control staff was not made aware of these intentions. The same facility was experiencing unacceptable downtime for neurovascular MRI scans. When the MRI suite was initially completed by the contractor, the suite was properly cleaned and then turned over to the hospital. The neurovascular coils were replaced under the manufacturer's warranty. And remember, this was a chronic failure, so this was happening frequently. Because of the chronic nature of the failures, the manufacturer told the hospital that unless they replaced the floor with a flooring system that would dissipate the electric charge, they would no longer cover the replacement of the coils under the existing warranty. The cost to the hospital would then be $45,000 per coil to replace. The downtime of the MRI was also a concern as to the impact on profitability. So let's get started and look at this from a root cause analysis standpoint. Okay, let's explore our logic tree in this case. We're going to move to presentation mode, and our event in this particular case is going to be unavailability of the MRI system for neurovascular scans. Our event is the last consequence and really what triggers the RCA to be done. This is going to be caused by the chronic failure of MRI coils. This is going to be the mode. What we have to remember with event and mode that these are both true. So now we become hypothetical and ask, how could the chronic failure of MRI coils create the unavailability of the MRI system for these scans? Well, the possibilities when we look in total are the failure of the body coils, failure of the extremity coils, and the failure of the head coils. And we understand from this that the body coils and the extremity coils would not affect the neurovascular scans, as the neurovascular scans would be focusing on the head coils. So understanding that these would not be a contributor under this particular case, we would focus on the failure of the head coils. The questioning remains the same. How could I have a failure of the head coils resulting in the unavailability for neurovascular scans? The possibility here is singular, and it would be phased array neurovascular coils that fail. These are specific for the head scans. So only the failure of these types of coils would result in the unavailability for neurovascular scans. So we become hypothetical. Again, we say, how could these coils be failing? And I do want to note at this point that you'll see these confidence factor numbers in the lower left-hand corner of each of the nodes. These represent confidence factors or strength of evidence. The scale is from 0 to 5. A 5 means with the evidence that we have, this is absolutely true. A 0 means with the evidence we have, this is not true, and we would indicate that by an X over it. And we are only following the things that are true. Okay, so at this point we're going to ask, how could we have phased array neurovascular coils that fail? And these would be the ones specific for the head scans. They're operated beyond design lifespan. This is not the case. They were damaged mechanically or electrically. This is not the case because of our review after the failure of the failed parts. This metallurgical review after the failure of the parts demonstrates that the patterns on the failed coils are due to the generation of static electricity. So how could we have the generation of static electricity? Well, one of the possibilities is that it can be generated by low ambient humidity, which requires motion. The other is static electricity generated by the technician. In this particular case, the evidence proves that the static electricity was generated on behalf of the technician. How can this happen? The flooring system permits static electricity to form. Something on the flooring system allows the static electricity to form, or something on the tech allows the static electricity to form. The evidence collected in this particular investigation demonstrates that there was something on the floor allowing the static electricity to form. So the questioning remains the same. How can that happen? Either the floor was electrically insulated or there was dirty film on the floor. In this particular case, the evidence shows that there was a dirty film on the floor which was allowing the static electricity to form. How could we have a dirty film on the floor? The MRI contractor did not provide the required initial cleaning. This was proven not to be true. When the MRI contractor turned over the MRI suite, it met all of the requirements and the specifications. However, once it was handed over, the MRI room was not being cleaned properly by the hospital staff. The PR represents the physical root. This is an observable consequence of a decision. How can that be? The hospital cleaning equipment could have had an issue which caused this floor to be dirty. That was not the case. There was an inspection of this cleaning equipment. It was not the case. We could have had a hospital staffing issue. Maybe in housekeeping we didn't have the number of people that we needed to clean properly. This was not the case. There was a decision to cut the housekeeping staff for safety reasons in the MRI suite. I emphasize this because there was a decision to keep the housekeeping staff out of the MRI suite for safety reasons. Now this becomes a human root because it's a decision error. So now we want to say, why would we make the decision to cut the housekeeping staff and prevent them from going into the MRI suite? Housekeeping in the MRI room was viewed as a low priority by the radiology staff. Lack of knowledge of the possible infection control effects. No quality control review of the upstream and downstream effects of this decision to remove the housekeeping staff from the MRI suite, and no regulations that required such housekeeping practices. So there wasn't essentially a violation. So when we look at this in its total, and we go ahead and we activate a show to failure feature here, path to failure, the LRs are the latent roots. These are the systemic issues that fed information inadequate into the decision maker's head, which is the HR. So we have failed systems or flawed systems which feed poor information to decision makers. As a result of that, they make poor decisions. And then we can see we can correlate directly by cause and effect all the way from bad systems to bad decisions, all the way up until we experience the unavailability of the MRI system for neurovascular scans. Okay, so let's recap our findings. Housekeeping was removed from the MRI suite for well-intentioned safety reasons. However, housekeeping in the MRI room was not viewed as a priority by the radiology staff. There was a lack of understanding by the staff of the possible infection control effects of the decision to remove housekeeping. There was no quality control review of the upstream and downstream effects of removing housekeeping from the MRI room. There were no regulations that required housekeeping practices in the MRI suite. Okay, I also wanted to focus on the proactive benefits of this particular root cause analysis, keeping in mind that when we initiated this, it was because of the lack of availability of the MRI system as a whole, not because of the decision that they wanted to use this room for other purposes. This analysis identified a risk that would have likely materialized if breast imaging and biopsies were permitted to be conducted in the MRI suites, because they were not clean room atmospheres. They actually had dirt on the floor, which could be a source of infection. This analysis also highlighted another hidden system flaw where infection control was not made aware of the hospital's intentions of adapting the MRI suite for other uses. Okay, I thank you for your time. For more information on this case or the RCA approach used, please visit www.reliability.com. For access to the feature article highlighting this case, please click the button below. Again, thank you for your time.